Okay, I guess we are now live and our numbers are starting to stabilize a little bit. I would first like to just acknowledge and celebrate the first Australians whose lands we are meeting on here on the ANU campus, and many of you also in Australia, and to pay our respects to elders past, present and emerging. So I'm Ryan Edwards, Deputy Director of the Development Policy Centre here at ANU, and hosting with me today I have Arachika Okazaki. Thank you everyone for taking time out of your really busy days, particularly big thank you to Caroline for joining us. I appreciate there's a lot going on at the moment. For those of you unfamiliar with our centre, we're a think tank focused on research and practical initiatives to improve the effectiveness of Australian aid, to support the development of PNG and the Pacific Island region, and to contribute to better global development policy. We were established in September 2010, and we are still celebrating our 10th birthday this year. Since many of our regular events like the Pacific Update in Fiji have been cancelled due to coronavirus, we've introduced these monthly labour mobility webinars as a way to keep in touch and to try and keep the discussion going. We do record and post the resources from these events online, so you can follow up later or share with others if you found the work helpful. Next month, we'll have the World Bank's Labour Mobility team sharing their recent work on remittances during COVID. And on October 7, we'll be hosting our annual aid budget breakfast to discuss the Australian aid budget. Now that intro spiel is done, I'm very, very happy to have joining us today Caroline Theoharides, who is an assistant professor of economics at Amherst College. Her excellent work centers on labour migration from developing countries to richer countries, and in particular the role of human capital investment, specifically in education and on labour market outcomes. Today, she's going to present an exciting new paper, which is joined with Paulo Abacar from Mathematica on medical worker migration and origin country human capital, evidence from US visa policy. A lot of you who are in the room, I know I've had a long-standing interest in issues around brain gain and brain drain, and this is one of the most exciting papers I've seen on this topic in recent years. I'm glad you could join us today. And without much further ado, I guess I'll hand over to Caroline to share her screen and to kick off. We'll have about half an hour for the talk and then go to Q&A. And we can take some questions as we go if they're super urgent, but otherwise it's probably good to hold it to the end. And I'll mute with that.
All right. Great, fantastic. Thanks so much for having me, Ryan and Ari, and thanks to all of you for joining in. So I'm excited to present this work today that's joint with Paulo Abacar called Medical Worker Migration and Origin Country Human Capital, Evidence from US Visa Policy. And so thanks for having me. I think this is the closest I'm going to get to traveling anywhere for a long time, so it's nice to at least virtually be in Canberra. All right, so many countries face shortages of medical workers. Many developed countries face shortages of medical workers. Sorry, I'm just getting my Zoom screen a little bit better set. There we go. All right, and so to fill these gaps, countries often recruit foreign-born nurses. Okay, so you see a lot of wealthy countries recruiting foreign-born nurses from developing countries. So for these migrant-sending developing countries, recruitment may lead to a scarcity or a brain drain of healthcare professionals. Okay, and so as a result of this, the policymakers are often concerned about potential externalities for the local population. In particular, for the migration of healthcare professionals, this may lead to poor health outcomes for the local population. Alternatively, the recruitment of high-wage jobs may actually induce more investment in education. Specifically, if we see that more individuals invest in education than actually end up migrating abroad, this could result in what economists often refer to as the brain gain of healthcare workers. So the causal question that Paulo and I answer in this paper is, what is the effect of demand for foreign-born healthcare workers on the stock of healthcare workers and educated labor in the country of origin? And so to do this, we're going to use a migration policy experiment. And specifically, we're going to examine the effect of international migration of nurses from the Philippines on post-secondary enrollment and graduation. We'll also look at the supply of nursing programs and the quality of the degree. So to do this, we're going to exploit two changes in US visa policy that led to the expansion and subsequent contraction of visas for Filipino nurses to the US. So what we're using here is we're going to exploit the fact that certain areas of the Philippines have historically specialized in sending migrants to certain destinations and occupations. And this is true for nurse migrants to the US from the Philippines. As a result of this, you have some provinces in the Philippines that send a lot of nurse migrants historically, and you have others that don't send many at all. And so as a result, the areas that have historically sent a lot of nurses have a higher treatment dosage than others. Okay, so formally what we're going to do is we'll use an event study methodology where our treatment is going to be defined as provinces with high levels of nurse migration at baseline. We'll compare these treatment provinces to our control provinces, which have low levels of nurse migration at baseline, and we'll look at them before and after these policy changes. So in terms of the, just to give you a little bit of a preview of the results, what we find is that the expansion and subsequent contraction of US nursing visas first increased, then decreased the migration of Filipino nurses. Nursing enrollment increased after the expansion, and then it also decreased after the visas were reduced. Nursing graduates responded similarly, but they had a 4-year lag because it takes 4 years to obtain a nursing degree in the Philippines. The other thing that we document is that the supply of nursing programs actually increased in order to allow for new enrollment. In terms of quality, we find that the marginal nurse who was induced into a nursing degree was less likely to pass the nursing licensure exam. But there were so many new graduates from nursing programs in the Philippines that even with these reductions in pass rates, the increase in licensed nurses far exceeded the number who were departing. Specifically, the result that we can tell you is that for each new nurse migrant who went abroad, there were 10 new licensed nurses in the Philippines. Okay, so documenting a substantial increase in the number of nurses that were in the Philippines. In terms of whether this is brain drain or brain gain, we extend this to think about human capital overall, of post-secondary educated human capital, and we show that the increases are due to individuals switching to nursing from other fields. However, these new nurses or new nursing degree enrollees actually persisted to graduation at a higher rate, thus increasing college grads overall in the Philippines. So in terms of contributions, we provide the first causal microeconomic estimates of medical worker migration on origin country human capital. Okay, and so this adds to a long literature on the brain drain and brain gain debate that a number of people, including some on this call, have contributed to. What we do that's a bit unique is we apply this to this context of medical workers, which arguably is perhaps the most important context to consider given the potential externalities in terms of health of the origin population. Something else that we do that we have in common with the paper by Kana and Morales is we focus on skill-specific migration where the supply of post-secondary education may not as readily respond. Most of these other papers examine aggregate effects on primary education, secondary education, or post-secondary education. We're looking at a very specific degree type. And so there's been concern around policy experts and amongst economists that measuring these supply side effects of changes in nursing programs is important because skill-specific programs may not be able to respond in the same way as just filling in seats in post-secondary education overall. We also are able to look at the quality of these nursing programs, which is something that has previously not been done in the literature. Another nice feature of our paper is the unique data that we have. These data, we're going to be able to measure skilled migrants before they leave the Philippines when they've obtained their education in the Philippines. So uniquely, what this allows us to do is to actually have a sample where everyone has obtained their education prior to migrating. Typically, papers will often rely on census data, and we don't at the destination country, and we don't know if individuals may have obtained their education after migrating. In terms of policy implications, our results refute the usual refrain about brain drain, and they're directly relevant to policy debates surrounding medical worker migration and the general reliance of wealthy countries on medical personnel from developing countries. We've seen lots of debates in recent years with the WHO and many developed countries actually discouraging or even banning recruitment from certain countries. And so what our results highlight is the importance of well-designed partnerships between migrant sending and migrant receiving countries. And I'll leave this with a caveat that our results may not translate to all contexts. In particular, they may not translate to the context of sub-Saharan Africa. That said, for low to middle income countries that seek to use migration as a development tool, such as Indonesia or Bangladesh or India, the Philippines may provide an optimistic example of the potential brain gain effects. Okay, so I want to jump in now to a little bit of background on Filipino nurse migration. So The Philippines, as you may know, is one of the world's largest migrant sending countries. Okay, so behind just China, India, and Mexico. And Filipino nurses make up the largest group of foreign-born nurses. This is rooted largely in the colonial relationship between the Philippines and the US, because during the US colonial period in the Philippines, the US set up a lot of nursing schools and began exchange programs with nurses between the US and the Philippines. As a result, today, the United States is the largest destination for Filipino nurses, with about 74% going to the United States. And the returns are huge. So for Filipino nurses in the US, they earn approximately 10 times higher salaries. In addition, they're able to obtain legal status for their family members, which is not a benefit afforded by a lot of other key destination countries. Choi has some excellent work looking at the history of Filipino nurses in the United States. And one of the things that she documents is that migrant networks, which we know are important for migrants more broadly, but they're a key determinant of nurse migration patterns in particular. We often see batchmates in nursing cohorts that are all signing up for visas together. They go to recruiting agencies together and they migrate abroad. And then the next generation of students follows suit as well. In terms of the US recruitment of nurses, the most common channel for foreign nurses is through permanent employment-based visas, also known as EB-3 visas. There are about 140,000 of these visas granted per year, and nurses experience shorter processing time because they're known as a Schedule A occupation. So these are occupations that experience shortages in the US, which is true for nursing. Now, in terms of allocation, because of some diversity requirements by the US State Department, the Philippines cannot receive more than 7% of EB-3 visas that are granted, okay? This 7% is always binding for the Philippines. There's much, much more demand for these visas than there is supply of them. It's binding for a lot of different countries, but it's always binding for the Philippines. Now, the policies that we're going to exploit in our paper in terms of our identification strategy, first is the American Competitiveness in the 21st Century Act. So in 2000, what this act did was it loosened the per country limits in terms of visa allocation. In particular, so it loosened the fact that now the Philippines could have more than 7% of these visas. In addition, it also provided about 200,000 additional visas to Schedule A occupations, so to occupations where there are shortages in the US. So this period following 2000 led to a whole bunch more visas, many, many more visas that were actually available for these nurses. In 2007, the processing of these Schedule A visas stopped, okay? And so this was a contraction relative to the previous 7 years when nurse visas were relatively easy to come by, okay? In 2006, to give you a sense of the magnitude, there are about 6,800 nurse visas that were processed from the Philippines by the United States. This fell to about 2,300 in 2007, and I'll show you some more numbers on that. So what you can see here, these are plots that we made from our data on all permanent nurse migrants from the Philippines. And so you can see the black line with circles, that's plotting US nurse migrants over time. All right, so I think you can see my cursor. You can see that starting in 2000, this ramps up dramatically all the way until 2006. And then we see this precipitous drop in 2007 when visas were no longer available, okay? So these are the policy changes we'll exploit, this expansion that occurs in 2007 and in 2000 and the contraction that occurs in 2007, okay? I've also shown you in the dotted line, you can see non-US nurse migrants. This is relatively flat during the period of the expansion and contraction of US nurse visas, starts to increase mainly to Canada in this later period. And then you can also see non-nurse migrants on the right-hand axis and represented by the dashed line. Okay, well, is it brain drain or is it brain gain? Okay, so government officials in the Philippines during this period were quite concerned about brain gain. In fact, one was quoted as saying, this isn't a brain drain, but more appropriately, it's a brain hemorrhage of our nurses. Okay, so the Philippines provides this compelling example of where one might actually anticipate a shortage of these domestically employed nurses. Despite this fear, however, I'm going to show you some aggregate post-secondary enrollment and graduation data that suggests the opposite effect. Okay, so these data are from the Commission on Higher Education in the Philippines. And so what they're plotting is the number of students enrolled over time in different types of degree programs. This includes enrollment across all 4 years of college, so first years through seniors. It takes 4 years to obtain a nursing degree in the Philippines. So you can see, looking at the black circles, that in 2000, we start to see this increase in enrollment. It continues to rise until about 2006 and then begins to drop. Okay, it doesn't drop dramatically because what we see is that individuals are finishing their degrees. So they, if you're a second year in college, you're finishing your degree and you're finishing somewhere, in 2008, 2009, and new individuals aren't enrolling at the same rates in nursing programs. But let me just highlight what a huge effect this is. Okay, so we went from around 100,000 nursing enrollees per year in 2000 to about 500,000 students enrolled in nursing schools in the Philippines in 2006, right before the contraction occurred. Okay, so this is a huge response in terms of enrollment, and this is what we'll be exploiting in our identification strategy. Now, in terms of graduation, we don't have as long of a pre-period for graduation, but you see the same result, okay? Except now it occurs with a 4-year lag. This is again because it takes 4 years to graduate from college. So we start to see these increases around 2003, 2004, and we see these dramatic increases in terms of the number of graduates. It's not quite dividing the enrollment numbers by 4 because not everybody actually persists to graduation. Okay, in terms of the data that we use here are from the Commission for Filipinos Overseas, or CFO. And so this is administrative data on all permanent migrant departures from 1990 to 2014. These data are collected because each permanent migrant that leaves from the Philippines, along with their families, have to go to the CFO and receive departure clearance, okay? And so in doing that, they fill out a form that includes information on their demographics, their place of birth, country of destination, education, profession, a whole number of things like that. So we obtain these data from CFO, and as a result, we're able to calculate province-level migration rates for nurses to the United States. Okay, in terms of the education data, we use data from the Commission on Higher Education, or CHED, and these are post-secondary enrollment and graduation data. They're disaggregated by program of study, okay? So for instance, we know for the University of the Philippines, we know how many students are enrolled in a nursing program in a specific year, okay? And we know how many graduate from that program. We know the same for Ateneo, we know the same for Santo Tomas, okay? So we see this over time. As a result, we're able to calculate our key outcome variables of enrollment and graduation rates for nurses, as well as calculate the number of nursing programs in each province over time. So just to give you a quick view of some summary statistics, these are out of the total province population. So the migration rate of permanent migrants out of the province population is about 0.075%. Okay, so it's small. The total average rate of US nurse migration is about 0.004, okay, percent. So these are small rates, but they're pretty important in terms of the magnitude of remittances and the labor market options that they represent. About 21% of the college-age population is enrolled in post-secondary education. They graduate about 4% a year, so not everybody's persisting to graduation. Average province has about 4 nursing programs, mostly made up of private nursing programs with a few public nursing programs mixed in. Okay, so in terms of our empirical strategy, to give you a little bit more intuition on this before I jump into the estimating equation, what we're doing, to remind you, is we're exploiting this plausibly exogenous policy change that occurred in 2000 and the other one that occurred in 2007 that essentially expanded and then restricted nurse migration to the US. Okay, the aggregate results that I showed you provide suggestive evidence of the impacts of the policy changes, okay? But what we're concerned about is there could be other that are going on that are affecting things in the aggregate. So we want to isolate this causal effect. And so what we're going to do is we're going to exploit the importance of migrant networks. So specifically what we do is we're going to compare areas with high baseline nurse migration, our treatment group, to areas with low baseline nurse migration. And we're going to look before and after the policy change. Okay, so essentially we have a treatment group and a control group, and we're looking before and after. Okay, we're going to estimate this in a standard event study framework. Okay, so our outcome variable YPT is going to be something like nursing enrollment or graduation in province P year T. And we'll regress this on this binary variable that's equal to 1 if the province has above median nurse migration at baseline. That's our high variable. And we interact that with dummy variables for each year over our sample period. Okay, what you can interpret this interaction of the high nurse migration variable and the dummy variables for year is this is the effect, the differential effect in high relative to low nurse migration provinces in a specific year. Okay, so we're going to be able to trace out the dynamics of the effect in high relative to low provinces over time. Okay, we include provinces year fixed effects. We also have some baseline controls interacted with year fixed effects. Okay, in terms of our identifying assumptions, what you should be thinking about here is that in the absence of the policy changes, what we're assuming is that high nurse migration provinces would not have experienced differential changes in outcomes compared to low nurse migration provinces. Okay, so in other words, prior to 2000, we expect that these high and low nurse migration provinces don't look different from each other. Okay, so their dynamics are moving in a similar way. Specifically, what that means empirically is we should not reject the null hypothesis that our beta taus, our interaction of high and our year fixed effects prior to 2000, we should not reject the null that those are equal to 0, okay? And I'll show you this in all of our figures going forward. Now, what are some threats to this? Okay, well, we could have differential trending of outcomes by high and low nurse migration areas. We have province fixed effects, so that will control for the differences in levels. We also have baseline controls interacted with year dummies to account for some of the differences in dynamics between these high and low nurse migration provinces. I think perhaps a bigger concern that you might have is perhaps there's something else that happens simultaneously at the same time as these US visa policy changes, okay? So maybe there was an economic shock or some policy change that happened in the Philippines that's correlated both with nurse migration and our outcome variable. So what we've done is we've looked pretty carefully through documented changes in the healthcare system in the Philippines, and there were no major changes that coincided with our policy changes during this time. We've also looked through legislative records, and there were no major changes in terms of health policy or migration policy that occurred on the side of the Philippines that were happening simultaneously. In the paper, we show a bunch of different robustness checks. I won't talk about them in detail here, but I'm happy to chat about them when we continue with questions after. All right, so let's get to the results. So the first thing that we show is what I'm going to refer to as a first stage effect on nurse migration to the US. Okay, so if nurse migration to the US doesn't respond to these policy changes in high relative to low nurse migration provinces, we wouldn't expect enrollment to either. So we want to check first and make sure nurse migration responds. All right, so what am I showing you on these graphs? Well, the gray vertical lines, the first one at 2000 shows the point of the visa expansion, and the second one at 2007 shows the point of the contraction. Okay, so the gray solid, or sorry, the black solid line, that's showing you our point estimates from the event study. So for instance, this point right here is showing you the effect of being in a high relative to low nurse migration province in, say, the year 2002. The dotted lines are our confidence intervals, 95% confidence intervals. The dashed line is from a pooled event study estimate, which I haven't talked about here, but essentially what that's doing is it's aggregating our effects over full periods of time. And you can see the estimating equation for that in the paper, but it's just essentially tracking these in a more aggregated way. Okay, so what we see is that after the 2000 policy change, we see a pretty rapid increase in nurse migration to the US. That falls in 2007 and it never recovers to those same levels. In terms of the pre-period, now remember I told you we did not want to reject the null hypothesis that those betas are equal to 0. You can see there's a slight downward trend, okay? This is because low nurse migration provinces were catching up. They were trying to catch up in terms of nurse migration to the US. However, this is of the opposite sign and much smaller in magnitude, so I don't think it'll lead to much bias of our results. Okay, so moving on from this, we then look at the effect on nursing enrollment. Okay, and similar to the picture that we saw in the aggregate, what you can see is that enrollment increases rapidly following the 2000 expansion, and then in 2007, it begins to decline. Okay, again, there doesn't seem to be much evidence of pre-trends here. So this is exactly the story we saw in the aggregate, but we're able to see that in high relative to low nurse migration provinces, we're seeing similar results in terms of enrollment. Now, in terms of graduation, this looks similar as well. As I mentioned before, we don't have as long of a pre-period for the nursing graduation data, but what you see is that this followed starting about 4 years later, 4 years after the expansion, because that's when people were actually able to graduate if they had newly enrolled in a nursing program. And we see this increase in nursing graduation followed by a decline about 4 years after the contraction. Okay, so it appears people are persisting to degree even when the contraction occurs, but then it does start to decline. Okay, well, what about the magnitude of the effects? I think the pictures are really nice for illustrating what's going on, but we'd like to put some numbers on this in terms of what's actually happening. Okay, so the average effect on nurse graduation during the expansion was about 0.39 percentage points per year. Okay, so there was an increase of about 0.39 percentage points per year in terms of nursing graduates. The pre-period sample mean nursing graduation rate was about 0.13%. So this visa expansion led to about a 290% increase in graduates over the expansion period. Now, the average province had about 270 nursing graduates per year in the pre-period. So this yields about 783 new nursing graduates in high relative to low nurse migration provinces. Looking at our results on US nurse migration, the policy changes, the expansion in particular, led to 30 new nurses departing in average province in high relative to low nurse migration provinces during this expansion period. Okay, so what this would imply is that for each additional nurse migrant, there are approximately 26 additional nursing graduates for each of those migrants. Okay, so this is a huge effect, but what I want you to think about for a minute when you are thinking about the size of this effect is the aggregate response, okay? So in 1999, what I showed you was there were about 1,200 nurse migrants to the US. In 2006, there were about 7,300. So this was an increase of about 6,000 nurse migrants, substantial, but think about the results I showed you for the Philippines overall in terms of nursing graduates. In 2002, 4 years after 1999, there were about 11,000 nurse graduates. In 2009, there were 113,000 nurse graduates. So there's a huge response that we're seeing in the aggregate. So we're not particularly surprised to find such a large result here either. So the next thing that I want to show you has to do with the supply of schooling. So this is a huge number of new graduates, okay? So how was the supply of schooling able to actually accommodate all of these individuals? How were there enough seats for these nurses? Okay, proponents of the brain drain argument often suggest that even if the returns to schooling were such that people wanted to enroll, okay, supply constraints would bind such that these individuals could not actually enroll. And individuals often say that this is particularly likely for specialized occupations like nursing, where it takes time to build up a nursing school, okay? So we're gonna examine this directly by looking at the effect of policy changes on the number of nursing programs in the Philippines. So you can see this is just total number of nursing programs in the Philippines over time, okay? You can see that in 2000, we see it's pretty flat prior to 2000. 2000, we see a pretty dramatic increase that then begins to flatten around 2007. Okay, but this is just the aggregate. There could be something else going on. It could be that there was a major expansion in the Philippine post-secondary education system during this time. So I want to look at this in my event study framework. So I do that here. And you can see that in the pre-period, there doesn't appear to be much of a pre-trend. So it appears that our high relative to low nurse migration provinces look pretty similar during this pre-period. But then following 2000, we see this dramatic increase. High nurse migration provinces are experiencing a huge substantial increase in terms of the number of nursing programs relative to low nurse migration provinces. This increase specifically is about 0.5 new programs per year, and it's driven both by public and private programs. There are many more private programs, so in terms of raw numbers, there are a lot more private programs that enter the scene, but in terms of a percent, public programs also respond. So it's interesting because what we're finding is that both public and private programs were nimble enough to respond to these changes in demand for nursing education. Okay, the next thing that we want to look at, though, is that this supply increased really dramatically. Okay, so what's the quality of these nursing schools, and what's the quality of the marginal nurse that's now graduating? Okay, so in particular, is the marginal nursing graduate, as a result of these policy changes, of the same quality as graduates from before the policy change? Okay, these new graduates might be less skilled because the new schools are less rigorous, or it could be that the students that are induced are themselves weaker. So what we've done to measure this is we use data on pass rates from the Philippine Nursing Licensure Exam in order to measure nurse quality. So we have data on pass rates for each institution in the Philippines over time. We got hard copy PDFs from the Professional Regulation Commission in the Philippines, and we were able to encode these and then create province level pass rates, okay? The NLE is an important exam because you have to pass the NLE in order to practice nursing in the Philippines or to apply for jobs abroad, okay? So this is a prerequisite for either nursing in the Philippines or abroad. Overall, national pass rates declined over our sample period, but again, we want to look at that in terms of our identification strategy of looking at high relative to low nurse migration provinces. Okay, so what we'd like to know is we'd like to know how the pass rate responds, where we define pass rates as passers out of examinees. But there's a small issue with this, which is that not every province in the Philippines actually has people take the exam in every year, okay? So if we were to do this, we would be left with a sample that's pretty different from the sample that our main results are estimated on, okay? Now I'd like to keep the sample the same. So what I'm gonna do instead is I'm going to estimate two regressions where I'm gonna compare high versus low nurse migration provinces in the pre and post period. Okay, so just a basic difference in difference because I just want to get an average effect from 2000 to 2013. In the paper, we also look at this in the event study framework, but I think this nicely captures the point of what we want to say about quality here. Okay, so in column 1, you can see that the outcome variable we're looking at is passers out of the population. And so in high relative to low nurse migration provinces, after the policy change, the number of passers out of the population increased. Similarly, in column 2, you see that the number of examinees out of the population increased. Now, this is probably not that surprising. We've got a whole bunch more graduates, so a whole bunch more people take the exam, and a whole bunch more people pass the exam. But what we can do is we can divide the coefficient for passers out of the population in column 1 by the coefficient for examinees out of the population in column 2. And what this will give us is an implied pass rate, which is 39%, okay? Because what we really want is passers out of examinees. So what we do in column 4 was we test this against the pre-period pass rate, which on average was 58%. Okay, and as you can see from the p-value, we're able to reject the null hypothesis that these are the same. Okay, so it appears that pass rates have decreased after the policy expansion and after the increase in the supply of nursing programs. Now, that said, so the pass rates have fallen, so that would suggest that the marginal nurse is of a lower quality. But despite these slower pass rates, so many individuals took and passed the exam that each new nurse migrant led to 10 new licensed nurses, okay? So even though more people are failing, so many people are taking the exam that the Philippines is actually left with 10 new licensed nurses for each nurse that migrates abroad. And so this is a really substantial result in terms of actually thinking about what this means in terms of the nursing stock in the Philippines. Okay, so the next thing that I want to look at is the effect on non-nursing enrollment. So what I've shown you so far is that it appears that there's a brain gain in terms of nurses in the Philippines. But what about the overall stock of college-educated labor? Okay, so what I'm going to show you here is the effect on non-nursing enrollment and on total enrollment in the Philippines. So our results aren't particularly precise here in panel A, but what you can see is we see this U-shaped figure that basically looks the opposite of the nursing enrollment rate figure, suggesting that there's some sort of switching behavior with people moving from non-nursing programs into nursing programs as a result of these policy changes. The total enrollment rate, these results corroborate this. This is essentially flat. There's no change in enrollment overall. Okay. So this would suggest that people are moving from these other types of programs and moving into nursing programs. We also look at this in terms of graduation. Okay, so in terms of non-nursing graduation, this is relatively flat, but what you can see in panel D for the total graduation rate is that this appears to be an increase. And if we test the joint significance of our coefficients in the post-expansion period, we're able to reject the null hypothesis, and we find that there's a statistically significant impact on total graduation rates in this post-expansion period. Okay, so what this suggests is that even though there weren't new people enrolling, for some reason, individuals in nursing programs are actually persisting to their degree at a higher rate than when they were in non-nursing programs. Particularly if we were to put a magnitude on this, what this yields is 126 new graduates in the average province in response to this expansion period. Okay, so this is suggesting that there is a real increase in the human capital stock in terms of college-educated labor in the Philippines. All right, so the final thing that I want to mention here is what happens to these nursing graduates who don't get a visa. Okay, so there are a bunch of different options that they could take. So what we show in the paper is that a very small share of them migrate as nurses to other destinations. It doesn't appear that they're absorbed by temporary contracts, so working as domestic helpers or caregivers as is occupation from the Philippines. Some are doing this, but they don't appear to be absorbed by this. There are no major increases in these groups over this time. We use the Philippine census to show that there's a large increase in nurse employment in the Philippines in high nurse migration relative to low nurse migration provinces over the expansion period. And so what we want to think about here is, well, what's causing this increase in nurse employment, okay? As I told you before, there were no major healthcare expansions during this time. And what it appears is that this is driven by a program called RN Heals that the Philippines developed in response to how many nurses were in the Philippines. So in particular, what the RN Heals program does is it takes nurses from high nurse migration areas like Manila, and it brings them for 6-month tours in rural areas where the population is underserved by medical care. Okay, and so these individuals are counted as nurses in their location of origin, the high nurse migration area. There's also a lot of professional volunteer nurses. These are individuals who are trying to obtain experience as a nurse before they go abroad. They can't get a job as a paid nurse, so they volunteer in a hospital in Manila. And so we see a lot of that as well. Now, what about those that don't pass? So those that don't pass, the Philippines, similar to the RN Heals program, implemented something called the Universal Healthcare Implementers. They have public health associates. So these are individuals that they need to have some medical training, but not a full nursing degree, that are going into provincial areas and helping with healthcare. We also see a lot of these workers that are working in business process outsourcing, or BPOs. So essentially they're working in call centers, some related to health, some not related to health. Okay, so to conclude, enrollment and graduation from nursing programs increased dramatically in response to demand for foreign nurses from the United States. The number of nursing schools rapidly expanded to accommodate increased demand. And although students passed licensure exams at lower rates, the increase in licensed nurses outweighed the increase in nurse migration. So in particular, the result that I told you was that for each additional nurse migrant, there were 10 more graduates who passed the nursing licensure exam. So they were a fully licensed nurse. They met all of the credentials that were required by the Philippines to be a nurse. I also showed you that there was an overall increase in the stock of college-educated labor in the Philippines. Okay, so in terms of welfare, there are a number of benefits. So the Philippines gained more nurses, and they had many more nurses working in underserved areas. Those who migrated were able to experience huge gains in wages, legal status for their families, and they were also able to send remittances back to the Philippines. However, there are also a number of costs in terms of this policy. So many of these nurses remained unemployed or in volunteer positions, and they switched to nursing from other fields. Okay, it's unclear, and we don't have the data to be able to test if remaining in those fields would have had greater development impacts or greater positive impacts on their households. And so ultimately what our paper is able to provide is evidence of the partial equilibrium effects of demand for foreign nurses on education in the origin. And so what we think is that these overall welfare calculations, while they're beyond the scope of our paper, they should be the subject of future research. Okay, and so just to wrap up in terms of some policy implications, our results provide useful evidence for many low to middle income countries that seek to emulate this worker export process of the Philippines. As I mentioned before, our results may not apply to the most underdeveloped countries that have limited post-secondary infrastructure, but we think for countries that are trying to use worker export in terms of a development strategy, that our results are particularly informative. Our results also highlight the importance of well-designed partnerships between receiving and sending countries. And I think, so this is related to some work by Michael Clemens and others at the CGD, many of whom I think you have had here giving talks over the course of this seminar. So I'd love to chat about that more. And so these sorts of partnerships can actually present a win-win situation. They allow receiving countries to subsidize training for workers in sending countries, yet they're also facilitating the migration of these skilled workers and the subsequent remittance benefits that may occur. That's all I have, and thank you so much for listening. I look forward to our discussion.
Wonderful. Well, we don't have a discussant. So let me just pull up my yeah, that was really great, Caroline. I learned a lot. A lot of the things I thought about and asking you covered. You preempted almost everything, and I thought it told a really, really nice story almost from start to finish. We have one question from the audience. Tuan, do you want to speak the question so it can be more of a conversation, or do you want me to just read it? I'll see if I can go to unmute your microphone. Yeah. Are you there, Tuan?
I could see his question too, and I'll actually, maybe I'll just share my slides back so that I can show that, if that works.
Yeah, Tuan,
let me sh-
I think you're there. Oh, it says
Oh,
you can't.
can't use your microphone. Okay.
Okay.
But yeah, but I can see your question. So you wondered if we had a figure for the pre-trend before 2000. So let me show you that for nurse migration and education. I think you can see my slides. Is that right, Ryan? You can see them again?
Yes.
Okay, they're smaller now, but I think that's, so the pre-trend figure, you can see this right here. Okay, so this is going to be my pre-trend figure here. I'm doing this in this event study framework where what you can see is this is measuring the difference in high relative to low nurse migration provinces in our pre-period. So we don't want to reject our null hypothesis that these are jointly equal to 0. Okay, and so you can see it again here. So in both cases, there's a slight downward pre-trend, but it's of the opposite sign and much smaller in magnitude than our main results. So that's really where we're showing the pre-trend here. In our paper, we show these empirically and we give you the point estimates on them, and you'll see that they're quite small and generally not statistically significant. I think the only one that is significant is this effect on nurse migration to the US is significant, but really, really small. So hopefully that's helpful as well.
Nice. Next we have Hal. I've tried to unmute you, Hal.
Yep. Hi, Caroline. Thanks very much for a very interesting seminar. So I haven't read the paper, but I just have a couple of questions. Maybe they're in the paper. But as I say, I enjoyed it very much. First of all, I wonder whether you really need the province level story. I can see why it's a neat part of the story, but if you're thinking national, I wonder whether the province story matters, especially since there's a lot of internal migration in the Philippines, including, younger kids who migrate to cities for education. That's the first point, first question. Second one is, you'd worry about a one-off initiative like this of the US opening up and then closing down a bit if it were a kind of dead-end profession, with limited sort of skill transferability. I suppose the fortunate thing for the Philippines is that nursing demand globally, at least pre-COVID, or maybe including COVID, was rising quickly, mainly because of the aging in the wealthy Western countries. So there's a lot of market opportunities for, for nurses to go elsewhere. So they're the two main questions. I guess also there's as I'm sure you're aware, in the Philippines, there is a story, one sort of minor de-skilling story, which is one often hears of doctors who, in a sense, downgrade their skills to become nurses because access to international nursing labour markets is easier than the medical labour markets. But as I say, thanks. I enjoyed the presentation.
Yeah, great. Thank you so much, Hal. Those are great points. Yeah, in terms of the province story, I personally have always found the aggregate story really compelling. I think that those figures that show enrollment, I think Paolo feels the same way. I think those really encompass a lot of the story, and we hope that that helps people buy our identification strategy. I think that that one of the, in terms of the internal migration for education, so one thing that we did was we took the census data for the Philippines and we looked at how many people are migrating to another province for post-secondary education. And it was only about 6% of students. So it's a relatively small percentage, and I don't think it can account for all of our results, but there is still that 6% that you mentioned. In terms of this being sort of a one-off initiative or dead end, yeah, I think that the reality of like the demand for nurses and even just for like caregivers working in Japan or in Israel, I think that these are common things that nurses are doing as well. I think that probably this is one of the reasons why the Philippines has pursued nurses to such a large extent relative to other professions that might not sort of have that transferability. In terms of the de-skilling story, that's interesting. It's something I've been thinking about a bit recently. I'm not sure that we can say anything in our data about that, though I guess we could try to look at the, in our CFO data, we know their profession prior to migrating. And so I think we would be able to see if they were a doctor prior to migrating and what occupation they're going to be going in abroad. So it'd be interesting to just look at that to see what we can do. So I'm going to add that to my list of things to do. It's a great suggestion, and I hadn't thought about the ways we could do it before. So thanks a lot for that. I appreciate it.
Great. Next, let's go to a question in the Q&A, which I will take the liberty of reading in case Richard's microphone isn't working, because I guess he would have raised his hand otherwise. Richard Curtin is a research fellow with us here at the center and is asking, what was the difference in graduation rates and migration rates between the government and the private nursing training providers?
Yeah, so let's see. So migration rates, I don't know. We don't know the institution that individuals went to in our migration data, unfortunately. So I can't answer that. In terms of graduation rates, the graduation rates, I would say it's a mix. So certainly many of the historic private nursing institutions in the Philippines have excellent rates of graduation. But that said, many of the new ones that cropped up in response to this, I think were perceived as a little bit more fly by night and have much lower rates. I can look at that more carefully. We've sort of aggregated this to the province level now, but I can look more carefully at rates of passing by private and public. That's data that we have. I don't have the answer to it for you now. But my sense would be that there are going to be lower pass rates in the newer private institutions, though I don't want to generalize that too broadly.
Great. I just wanted to also mention that we're lucky to have the paper's other co-author, Paulo Abacar, on the line. So I've unmuted Paulo in case he also wants to chime in and answer any future questions or just share any other comments. Next, Fredo, asking you to unmute.
Hi, it's good to see Hal is also here, by the way. I just had one quick question, whether you had any idea of which fields the new nursing students came from. I mean, are we pulling from the humanities? Are we pulling from medical doctors? Because that has, of course, also welfare implications.
Yeah, so it's a mix, I would say. So it's large, and I am still sharing my screen. So let's see. So you can see it in the aggregate here. I don't have this in the event study in this presentation, but let me hear, where is it? Let me show you here. So you can see that they're all sort of dipping in response, or you can kind of see this compensating. But in terms of like the event study framework, a lot of them are coming from business degrees, some from STEM, not a whole lot going on from the humanities. The education results, you can see this here, but there's not a lot differentially by high and low migration provinces. You know, and I think in terms of thinking about the welfare implications, the way I've sort of thought about it is, you know, in terms of the business, I'm not sure that necessarily that welfare trade-off, but if we have a bunch of NGOs that were building bridges and developing infrastructure in the Philippines that now are nurses that can't migrate, maybe we're concerned about that sort of. Can't a whole lot more about that. That is sort of the type of switching that you see. I think it's really the next paper that somebody needs to write, is thinking about these welfare implications in terms of what's going on here.
Thank you.
Does that kind of help, Alfredo? Yeah, perfect.
Cool. Let me see. Oh, do we have another Q&A? Answer? No, we do not. So while I wait for another question to come from the participants, please do raise your hands if you have more questions. I will ask. Oh no, we do. Dika, one of us. I'll go with mine, and then we'll go to Dika. Well, allow a few more to come in. So I was just wondering, in terms of the research design and identification strategy, do you think about this, like the class, and do you think about the class of like the approach of going in the high and the low as being similar to a Bartik style approach with the initial exposure and then the shocks coming in over? Because the shocks are definitely external. And is there much changing in terms of the treatment within the time period that you know what I mean, within your studying versus the pre-exposure? Because I'm just asking, because in some of my papers, people often come back to me and be like, why don't you just discretize your continuous treatment? And I've often not been too sure about whether I should have or not, about whether going the high or low approach was right. And then my other question was just, how do you see it fitting to your other work on particular high school educational attainment and broader educational attainment? Do you see this as part of a pipeline type story? Do you think people are differentially changing their investments as well at earlier stages, even lower in response to these policy changes? Because this seems really close to Satish and Michael's one, which is very like the Fiji one, right? But I wonder how this fits into the broader kind of life cycle picture of what people are doing in terms of human capital. That's my only two questions.
Yeah, absolutely. So I think this is related to the Bartik style instrument. So I have another paper where I explicitly use a Bartik style instrument for the Philippines. And it's, it's similarly using like base shares, but it's looking at them in the, multiplying them by the aggregate. So it's a little bit different in that I'm just taking these base shares and using that as treatment rather than like trying to predict something in terms of the number of nurses. But there is a pretty high correlation. Like if we were to look at the correlation of the base share migration rate for nurses in 1990, which is our base year, relative to like, even taking like the 2010 nurse migration rate, there is a high correlation. Though that said, these start to erode a little bit over time as we see migration sort of going through the Philippines more broadly. If you think back to 1990, migration was confined much more to specific provinces, and now other provinces are being able to capitalize on that as well. In terms of like whether, like how we decided to use the discrete versus the continuous, this is something that comes up for me all the time as well. I have another paper that it's continuous because that's what the referees wanted in the end. So I don't know if I'm supposed to admit that, but there you go. And so here, I think we thought it was nice in the sense that one critique I would have of a continuous one is that you're essentially linearizing it. And so sometimes people don't like that. So here, but that said, we're also losing a lot of nice variation when we put it in the discrete case. So what we've done here is we've done the continuous example as well. The results are robust. And so we can show those as well. We don't have them in the main paper, but we could easily add them into the main paper. Because I think that I think people have different opinions on what they would prefer to see. So maybe we'd be better off just showing both of them in the main paper. I don't know if that's been your experience.
I think this really allows you to show the two trends in the charts that just jump out at you with the null pre and then what happens in the post. And you can't do that, or not as intuitively the other way. So I really like that.
Yeah, and then in terms of like the Fiji paper that Satish and Michael have, so that was like, that paper definitely for me was an inspiration for this paper. I love that paper. So it's nice to kind of be contributing to that work. And I think that I do think that so the Philippines has high rates of education for a country of its income level. People really are graduating from secondary school and things like that. Though in some of my earlier work, I do find secondary schooling responses to migration opportunities. I certainly think this could be happening. I have a distinct memory anecdotally of being in Batanes, which is the most northern, most remote province in the Philippines with my husband back in 2008. So this was right after the contraction period. And we were talking to these kids in the street, and we're in a really remote part of the Philippines, and all of them had siblings that had studied to become nurses. So I think, and this was, affecting their goals of them wanting to be nurses. And so I think this was a very salient, and this was long before I thought of writing this paper, but this was definitely something that was salient throughout far-flung regions of the Philippines, I would say.
Yeah. Cool. I'm worried about not getting through the other ones now. We've got a few. Dika, can you hear me? And are you unmuted?
Thank you so much for your presentation. I really enjoyed. I have a question. To what extent you have number of nurses required for each province, in a way that you can argue during the expansion period that the search is mainly to serve the overseas market and don't really negatively affect the nurse demand in that high-standing province. So there is no shortage of nurses. And the story is also the other way around. Like after the restriction, the declining number of visas granted to overseas nurses in the US, then you will see that this increased number of nurses, they help to sort of like meet the demand of the nurses in other regions. Do you have any sense about that?
So in terms of, just to make sure I understand your question, you were saying like in terms of how do we know that the provinces weren't sort of depleted of the nurses during the expansion? Is that, yeah. So I think that comparing the number of migrants relative to the number of graduates and then the number who were licensed is kind of how we're thinking about that. So it's on average, we're thinking about this for the average high province relative to the average low province. So certainly there could be some outlier provinces that were adversely affected by this. But on average, what we're seeing is that there's actually a pretty small number of people that actually are able to successfully migrate to the US, but there are a lot of people that responded. So in fact, for each person that goes, there's about 10 people that are licensed, suggesting that we are ending up with this surplus. But you're right. I think that we're getting the average treatment effect. There could be heterogeneous treatment effects that some provinces may have been left behind for this. And that's something we don't look at here, but it might be interesting to look at that kind of in relation to Ryan's question as well. Does that kind of, yeah, go for it, Ryan.
No, Digga, good?
Yeah, that's good. Thank you.
Well,
Thank you so much for the
one of our
question.
PhD students. And we have another one now, Chris.
Hi, Caroline. I actually posted my question in the question and answer box, but yeah, I love the presentation and I appreciate your work on the Philippines. I think that one of the largest issues, despite the brain gain with this increase in nursing enrollment and graduation, is in fact the educated unemployment. That is, you may have finished your degree, but I think one issue is that you mentioned there is no change in like the supply side in terms of the number of institutions that can absorb the nursing graduates. So one of the larger issues is like the nursing graduates that aren't able to go anywhere, as well as the educational mismatch, which you touched on as well. Nursing graduates going to other fields that not necessarily need the skills generated by the nursing degree. So I think it might be worthwhile if you could look, or rather, do you explicitly look at the effect of the visa policy on educated unemployment?
Yeah, so that's something that we really, maybe we could look at just educated unemployment. So we really wanted to be able to say something about like, what are people that have a nursing degree but don't migrate as a nurse and don't get hired as a nurse in the Philippines? What do they actually do? So one of the reasons for me in writing this paper was I was, hanging out in Manila several years ago and was reading, news articles as this was happening and seeing like this unemployment. And so, we can't look at specifically people who have a nursing degree but don't work as a nurse, what they're doing. That's not covered in the labor force survey, but we could look at skilled unemployment just broadly. And that's something we should definitely do. That's a great suggestion. I think that I think that that's kind of the next research that needs to happen on this topic, is thinking about exactly the question you're saying. I mean, I think we have documented like there are these nurses, they didn't all leave, but what about this kind of like brain waste phenomenon that may be happening as a result? And so I like your suggestion about looking at skilled unemployment. I think we can definitely do that. So thank you so much for that.
So, thank you again.
Cool.
This is
Stuart?
Yes. This is Paulo, and I just want to add to Caroline on that. And, there's a lot of actually qualitative evidence and discussion in the media that say at least that a lot of the Filipinos who graduated during this period as nurses went on to become a part of like the call center or labor force. And that actually fueled the boom in call centers in the Philippines, because this is a job that really, didn't really need some specialized skill. And, as long as you were able to graduate in college, then, that would be good for you. And so this is something we can't really confirm, but there was certainly a lot of suggestion by the media and some qualitative evidence that, people who couldn't be employed as nurses in the Philippines became like part of that industry. So I just wanted to put that out there.
Yeah, thanks a lot, Paulo. That's great.
Thank you, Paulo. Sorry, I introduced you as the next question, which is Stuart rather than Paulo. But Stuart, are you there and can you hear me?
Yeah, can you hear me?
Yeah, so I'm just going to try and move yours from the Q&A to actually speaking, if that's okay.
Okay. Thanks very much, Caroline, for a fantastic presentation. My question is similarly posted in the box, but essentially, if the same program was done for with STEM graduates rather than nurses, would that have a greater domestic economic contribution if a lot of surplus STEM workers were unable?
Yeah, this is super interesting. I've never thought about it exactly like this. I think it's fascinating in terms of the policy. I think that, some of it is, to me, is similar to the example of nurses, where in the areas where there have historically been a lot of nurses, there isn't a shortage of nurses. Similarly, there might not be a shortage of STEM workers, whereas out in some of the more rural provinces, we need both more nurses and we need more STEM workers. And so if an engineer is able to go to this rural province just for a few days and help with infrastructure of building roads and building bridges and things, I think that that could potentially be more I don't want to say more effective, but could be a sort of a strategy that makes sense, whereas a nurse really has to physically be there in terms of treating patients. So I think that's really interesting. Now, in terms of if we would see this type of effect, I think that, the Philippines has sort of had this long history of nurse migrants and the development of the nursing education system and things like that. I don't know how readily STEM workers would respond. I mean, so Gaurav Khanna and Nicholas Morales have some work in India showing really rapid responses to the IT sector with changes in US visa policy. And so that's suggesting that you would see something similar. I don't know if the schools in the Philippines would be nimble enough to respond in this particular field, because that's sort of not something that they've historically specialized in exporting. But I do think that Gaurav's paper provides some nice evidence that is a possibility. I don't know if you want to add anything to that, Paulo. It looked like you were unmiked, but.
Well,
I don't really, you've got everything fully covered, okay. So I don't really want to talk, but.
I saw you were unmuted, so I just wanted to offer. That's fascinating, Stuart. That's fascinating, Stuart. That's something I'm going to give some more thought to, because I think that is a nice way to think about the policy implications of these sorts of things and of, labor migration programs more broadly. Should we try to export things that will help our own development, I guess, is another way to phrase that.
Excellent. Thank you very much.
Thank you.
I'm not sure if we're almost at time, but there was two other things I wanted to do. I'm not sure if Chris had another question, but I wonder, just because I know that Satish has a lot of personal anecdotes from his paper that motivated and underpins a lot of the research. I wonder, Satish, if you wouldn't mind, if I could direct the question to you, what's your perspective on this question about basically the graduates left behind? Because I feel like it's surely the case that there was more people wishing to leave Fiji than there were places in response to the big effects that you document in your paper. Do you have a sense of what's going on there in terms of the employment effects of the accountants and the other qualifications that were differentially selected into?
Thanks, Ryan. Look, I don't think we looked at that specifically, but given that I come from Fiji and I do go home a lot, some of those folks, yes, there is an issue of educated unemployed, as Caroline mentioned. I think that's probably the same as that in Philippines. But in the case of Fiji, it's a much smaller place with a lot of regional mobility. So quite a few tertiary educated Fijians, accountants, teachers, and so on, actually moved across to the other Pacific islands where there were void in the labor market. So we did see movement out of Fiji of skilled workers within the Pacific Islands to Papua New Guinea, to Solomon Islands, to the Republic of Marshall Islands. So you do see nurses as well, by the way, Caroline, who are working in the region. But again, we haven't looked at that closely yet.
Cool. Sorry to put you on the spot. I was just thinking.
No, thank you. That's great. Yeah.
Okay.
Your paper is one of my favorites. So.
Thanks, Caroline, for the kind comments.
No, it's one of my favorite papers. I teach it all the time in my classes. So thank you.
Okay. Well, I don't have much else, and we are over time. So I guess we should probably think about wrapping it up. Yeah, I don't want to take any more of anyone's time. So yeah, just a huge thank you to Caroline for joining us from nighttime in Western Massachusetts. A big thank you for everyone for joining us in the end. We got some decent numbers and it was a pretty good group. So thanks a lot for taking the time out of your morning to join us. And please do feel free to send me any suggestions for future migration speakers you would love to hear from. But yeah, again, thank you so much for joining. Thank you to Caroline, and I very much hope to see you next time.